Good afternoon. I'd like to start my remarks today by passing my condolences to the family and friends of the late John Dallett. Having served in this building for a number of years with John, I always found him to be a fair Deputy Speaker, and I'm sure he'll be sorely missed by all who knew him, and not least by the heartbroken SDLP Assembly colleagues that he has left behind. And sadly today there are many other families in mourning. Earlier this afternoon a further 17 COVID-related deaths were confirmed. That was 17 more lives cut short, 17 people who we have lost before their time. And that's the reality. This virus is still very much here. It is still killing people and doing so in the least compassionate way. It's heartbreaking that so many families were not given the chance to say goodbye to their loved ones by giving them the wakes and the funerals that they deserved. And sadly, there will be more families thrown into mourning in the days and weeks ahead. Whilst the evidence would suggest we are through the worst of this first peak, the situation remains incredibly serious. Whilst the number of COVID-related patients being admitted to hospitals are falling, I remain acutely aware that the frontline fight has moved to our care homes. From the 16th of March, there have been 125 acute respiratory outbreaks in care homes reported to the PHA. 72 of these have been confirmed as COVID-19, with the remainder primarily the more common flu-like illnesses. That is why I want to ensure that everything that can be done to support our homes and all the residents and staff within them is being done. There has been a £6.5 million package of additional support put in place, along with further expansion of testing and the publication of updated guidance for care homes, aimed at strengthening infection prevention and control and protecting residents. I've also become increasingly aware of the significant challenges facing the domiciliary care sector at this time. That is why today I am announcing that payments to domiciliary care providers will remain the same as they would have received in the months prior to the COVID-19 pandemic. It's essential that we protect and support the carers and the companies that are looking after so many of our cherished older people at this critical moment. We must keep supporting those in the front line in any way we can. I'm on record as saying that this pandemic has underlined the importance of social care to our society and the need to take a long, hard look at the current model of care. But it's essential that we also put the measures in place to move to the next phase of fighting this virus. I'll ask the Chief Medical Officer to expand in a few moments on the latest position with test, track and trace. However, I'd like to reassure all those listening. In the last 10 days alone, there have been over 17,000 individual tests confirmed in our local laboratories or carried out locally as part of the national testing programme. We are now testing large numbers of patients, care home residents, health workers and key workers. That shows the expansion of testing that has been secured. I do have to acknowledge, however, that on other issues, I am becoming increasingly concerned. I'm concerned that the debate on the future of the lockdown is getting ahead of itself. That is getting ahead of the reality we are still facing. It would pile tragedy upon tragedy if Northern Ireland lost its way at this stage, if complacency set in. We need to stick to what we are doing to keep saving lives and protecting the NHS. The Executive is looking to map out a way ahead and to decide what form social distancing regulations could take in future months. That's the right thing to do. But please don't take this as meaning we're nearing the finishing line, or that we can ease up on what we are doing, because nothing could be further from the truth. I do not for 1 second underestimate what the people of Northern Ireland have achieved over the past 2 months. We have flattened the curve, we have fought back against the virus, we have saved many, many lives, and we have protected our health service and those working within it. But we have a long way to go yet. This is no time for bailing out or doing your own thing. We must all stick to social distancing. Any changes to the regulations will be gradual. There will be no dramatic overnight changes or big breakouts. It's part of my job to be honest with everyone. We can all see that traffic levels have increased in recent days, and I know the bank holiday weekend is approaching, and the forecasts are telling us of expected good weather. And I know how tough it is for so many people to be separated from loved ones and to be cut off from normal life. So forgive me for repeating myself yet again. Call it my May Day alert. Lives will depend on us continuing to do the right thing, washing our hands, keeping our distance. No matter how good the weather is, how strong the temptation might be, don't give in or don't give up. It's also vitally important that government continues to provide all the support it can at this really challenging time. This includes helping people with their emotional and mental well-being. So today I'm pleased to launch a new apps library to provide this type of support. Apps will be available which will help to manage stress, improve sleep, deal with anxiety, and provide advice on fitness and nutrition, all of which play a key role in helping us maintain our mental and emotional well-being. There are hundreds of thousands of apps available to the public, but until now, people have not had any help or guidance in terms of whether these apps are effective, safe, or beneficial. By providing a library of apps that have been reviewed by healthcare professionals, people can be confident that the digital tools they are accessing are safe and trusted. I will now hand over to the Chief Medical Officer.
Thank you, Minister. Good afternoon. It's my pleasure to have an opportunity to address you again this afternoon. Can I firstly again put on record my sincere condolences to all of those who have lost loved ones in recent days and weeks. As I've said many times, there will be a time after COVID-19. There was, as we remember, although it seems a lifetime ago, a time before COVID-19. It's important that we remember this too will have a beginning, it will have a middle, and it will have an end. But as the Minister reminds us, we are only yet at the beginning. It's important too that when we all look back, that none of us look back with any regrets as to the actions that we took at this time, the action that we took to protect ourselves, to protect others, and to save lives. We also know and remember that sadly, for some families, they will look forward to a time ahead without the loved one that they have lost. Every one of those lives lost matters, and every one of those deaths count. It is only because of your efforts that we have been able to reduce the number of deaths and to ensure that those individuals requiring care have been able to access that care. I know that the stay-at-home message is difficult, it's extremely stressful. I know also that the action that we are taking now is causing harm in terms of health terms, in terms of the economy, and in terms of wider society. But those steps and those measures that we are taking and need to remain in place for some weeks are absolutely essential to ensuring that we keep the virus suppressed, that we keep the reproductive number below 1, because if we fail to do that, we will again see an exponential growth in new cases, a growth in new admissions to hospital, a growth in people being admitted to intensive care, and sadly, further deaths. We have a long way to go yet, and it is important that we stick with the important messages of stay at home. It is important also that we recognise that the longer that we keep with that guidance around social distancing, around good respiratory and hand hygiene, the sooner we will all get through this and begin to come out to the other side of the first wave. And the sooner the executive can begin to make decisions about the sequencing of relaxing of some of the measures we currently have in place and the timing of that. Those decisions, as we've heard before, are finally balanced, and we will need to plan for that carefully, in a considered way, looking at the evidence and monitoring all of the time what the impact on that important R number is. Also equally important to that is the establishment of the Northern Ireland Contact Tracing Service. The Minister has said test, track and trace. It is hugely important, as we've increased our capacity for testing, that we use that testing, as I've said before, intelligently. As we moved from the containment phase in the initial weeks into the delay phase, the concentration of our testing effort was in those people who were sick and in hospital, and that was entirely right and appropriate. And we need to remember back that in those days we were able to carry out 40 tests only each day. That has increased significantly. As we move into the next phase, important is our eyes and ears. The testing or surveillance as to levels of transmission of COVID-19 in the community, so that's our sentinel surveys and our general practices in our emergency departments, our testing of patients who are admitted to hospital for either as emergencies or for elective surgery or for elective reasons, and also the testing that's ongoing in our care homes. But equally important is the capacity as we move into the next phase. The virus will evolve, and we will be moving in from a situation where we were having widespread community transmission to outbreaks. Those outbreaks may be regional, they may be local, they may be, as Minister has said, continue to be in our hospitals, they may be in our care homes, or they may be in a range of other settings. And what is vitally important is that we have the ability to identify those outbreaks where they occur, those individual cases of individuals who develop symptoms, that we rapidly get advice to those individuals to self-isolate, that we rapidly test those individuals, and that we rapidly ascertain the number of contacts that they have had, and that we get the advice to those contacts to self-isolate the sort of symptoms that they might expect, and also the testing of those individuals so we can rapidly keep the virus in check, and that we can prevent the R number, that reproductive number, again increasing, and avoid further episodes of community transmission. We did start, our public health agent started planning for that in April. We went live with the pilot of that testing on the 27th of April. We have plans to scale that up further by mid-May. And indeed, we're also working with colleagues in the Republic of Ireland and across the United Kingdom in terms of platforms, digital platforms, to support that, because contact tracing is a very human and very intensive exercise. We know that we will have to contact trace at least 80% of index case contacts for this to be effective, and to do so within 48 hours. So that will need both people, and it will require technology, platforms to support and retain the information, but also considering the use of digital proximity apps on mobile phones. No decision has been made around the detail of that yet, and that ultimately will be a matter for the Minister and the Executive in due course. I just wanted to conclude my comments by again mentioning the importance of the range of apps that the Minister has announced. We've all had to get used to accessing healthcare in a different way, and as I've said before, it looks different, it feels different, but the same people are there with the same commitment and dedication, no matter how you interact with health and social care. Some of those faces and smiles may be behind a mask or behind a fluid shield visor. Some of the hands may be in a glove, but again, it's the same care, dedication and commitment that is there. We are planning and preparing to scale up some of our routine service. Again, that's right and proper, because we are all mindful of the impact that has had as we responded to turning down some services in the first phase of our response to this wave. But equally, we need to ensure that we have mechanisms whereby people can look out for their own mental health and well-being, their emotional well-being, mindful of the psychological impact this is having on all of us, the psychological impact that it's had on those who have been bereaved, who have not had the opportunity to grieve in the normal way, to attend funerals perhaps in the normal way, the trauma on our frontline health and social care workers, health and care workers in the front line, the trauma that has had on all of us who have been separated from families and friends, and being social creatures, that human interaction which comes so naturally to all of us. So those apps, ranging from how to look after our mental health to how to maintain physical activity, which is so crucially important, are an important resource. We will develop those and we will add to those in coming weeks. And finally, just concluding, we are coming up to another bank holiday weekend. It is too early for us to drop our guard. Your response to date has been outstanding. You have saved lives, every single one of you, in terms of what you've done. And it is important that we stay the distance. It's important that you continue to heed the advice on social distancing and good respiratory and hand hygiene. It's important that you stay at home, that you protect each other, your families, and that you protect our health service. We still are not yet at a stage, as the Minister has said, where we can relax these measures at this time. Thank you.
Minister, Chief Medical Officer, good afternoon. Mark Devonport here from BBC Northern Ireland. I've got an inquiry which covers three distinct areas, if I may, if you can bear with me. First of all, are you concerned about the images that we've all seen of a plane packed with passengers travelling between Northern Ireland and London? Should our airlines and airports be allowed to operate in this way, which appears to be apparently a hangover from the pre-COVID world? Secondly, care homes, which you mentioned, Minister, should our care homes pay full sick pay to those workers who have tested positive for COVID-19? And what do you have to say to care workers like Shirley Ann Quinn, who caught the virus whilst caring for the elderly and has had to make do with statutory sick pay? And finally, sport. Following the news that golf courses in the Irish Republic are going to be reopening soon, should the courses on this side of the border open according to a similar timetable? And what do you see as the prospects for sport in general getting going as the weeks and months stretch ahead?
Okay, Mark, in regards to your three questions, first of all, I was shocked at the images of Aer Lingus. It was as if they were living in a time before COVID-19, completely oblivious of any of the regulations and social distancing and guidance that have been enunciated and published by our executive here, the government in Westminster, and how they could think that what the practice that they were actually carrying out was in any way in keeping with the guidance that we'd been issuing, I think was a sharp shock to them, that they should actually be behaving still in that manner, and I'll ask them publicly to actually revise that very quickly. In regards to the support of our domiciliary care workers and those people in care homes, that's why I've announced today that we will be paying domiciliary care providers up to what they have been doing and the payments they have been receiving in the past 3 months, plus the additional $6.5 million that we put into the care home sector a few weeks ago. So those support measures are there for those independent and private providers to support not just the staff but also the people that they look after on our behalf as well. In regards to the specifics of sport and golf, that will be a decision and a conversation that will be had within the executive on Thursday when we review the regulations and the recommendations that are coming forward as we look at our 3-week review that is required under legislation. So that conversation will be had with detail within the executive.
Hi, good afternoon. It's Vicky Hawthorne at UTV. Minister, you've said very clearly you believe that, or you're concerned that we're getting ahead of ourselves in terms of the discussion about starting to ease restrictions. Are you understanding that people are looking across the border where the Republic has published its time frame and people can start to see a light at the end of the tunnel? Are you saying that Ireland is getting ahead of itself? Can you explain to people in Northern Ireland why they shouldn't look and expect something similar here?
Vicky, very clearly what I mean is let's not get ahead of ourselves and where we are in regards to COVID-19 in Northern Ireland. It's fine, and I think it's right that we have the conversation as to what steps can be taken, but they start to put dates on them at this minute in time, I think, is getting ahead of ourselves. Let's see where the virus is in Northern Ireland within the next week, within the next fortnight, before we start putting timetables in place. Let's have the current conversation, certainly, as to what coming out of lockdown and changes to the regulations may look like, but let's not start putting dates on them, because that leads people into the false sense of security that when the date's set, that's where we're going and that's when we will be doing it, and that's not a place I want to be. But I'm certainly up that we should be having the conversations within the executive and within the populace in Northern Ireland as well as to what things can look like, what changes can be made, because I think the First and Deputy First Minister have made it clear during the next period of time we will not be returning to what we knew as being normal. There will be a new normal in Northern Ireland for a long period of time while we get COVID-19 under control.
Yeah, just to expand on that, Vicky, if I may, I think that the Minister is absolutely correct that the next steps in this need to be carefully planned and careful consideration given to the timing of any relaxation of the current social distancing measures. Some things are givens, however, that in terms of work, where people can work from home, that will undoubtedly need to continue. And we'll have to work very closely with colleagues, our trade union colleagues and employers, to ensure that we put appropriate safeguards in places of employment when those decisions are made by the executive. That decision is not a decision to be made now, but clearly there is work to be done and planning to be undertaken. Social distancing will need, as the Minister said, will be the new normal and will need to continue. Good respiratory and good hand hygiene will be with us for the foreseeable future, and that is a good thing because we will see some positives from that in terms of other viral infections. And also, we also need to, as Minister Mallon indicated today, we also need to think of some alternatives to public transport and what we are doing in that space. That's good in terms of reducing the risk of transmission in enclosed environments, but it's also good for our health. It's good for us to continue to engage in active travel, and those things will have important health benefits for us in the longer term. And perhaps we have an opportunity to build on the level of physical activity that individuals have been taking on their daily walks and their daily exercise, given the current restrictions that are in place. And I think in the future we'll also have to give particular consideration to the needs of older people, particularly those who are shielding, and particularly our younger people and the impact that has had on them. As the Minister has said, there are certain activities which carry higher risk, and we will look at the evidence. The Executive will have a conversation and discussion, make decisions for what's right for Northern Ireland based on how the virus is behaving here, informed by the evidence provided by myself and the Chief Scientific Advisor. And we know that there are certain activities which carry lower risk than others. So certain outdoor activities, particularly again when we adhere to the social distancing advice, carry lower risk than some other activities, particularly those that are in indoor environments and where social distancing can be difficult to adhere to. So I think that, to my mind, it is about the sequencing of those steps and assessing the impact that is then having on the R number. I think to put dates on that at this time would be very challenging. Some might say it is speculative because we just don't know the impact that easing any of the current measures would have on how the virus is spreading. And what we cannot return to, absolutely cannot return to, is widespread community transmission, exponential growth in the virus, and significant people again becoming infected and significant numbers being admitted to hospital. So that's why I absolutely support the Minister's contention that now is not the time to confuse the public about discussions about easing measures. It is certainly the time to indicate that we have work to do in terms of planning our way out of the current situation, but only when it's safe to do so, and now it is not safe to do so.
Good afternoon, Minister and Chief Medical Officer. David Young here from PA. We know the Irish Government published their plan on Friday evening, and the First Minister confirmed yesterday that you didn't get advance sight of a detailed briefing of that. Do you think that was in any way against the spirit of the Memorandum of Understanding that's been signed, and would you have expected to have seen that in advance? And I suppose going forward, will you be giving the Irish Government advance sight of Stormont's plans before they're made public? A technical question as well. There have been reports that there will be 2 different platforms used in terms of contact tracing on both sides of the border, north and south. Will that present any additional challenges in terms of the contact tracing piece? And would it not make more sense on the island to have one platform that does it all? And just maybe finally for the Minister, just his reaction when he read the news on Sunday in regard to his party colleague and former party leader Mike Nesbitt's actions in terms of the lockdown.
I suppose in regards to the Irish Government publishing their plan, I think an Irish one of their TDs or one of the politicians made it clear today that the plan was actually only finalised within Cabinet themselves before they went to publication and spoke to the people of the Republic of Ireland. So would I have liked to have seen more of a conversation? Yes. Was it politically possible for them to do that? That's a call for the Irish Government to make. As will we as an executive make our decisions on to how we plan and the steps that we take to publish towards the end of this week will be an internal one for the Northern Ireland Executive. Good manners is to talk to your neighbours and to make sure you know what you're going to do. Whether it's always possible in these certain situations isn't always practicable at this minute in time. In regards to the 2 apps, prior to this press conference, I was in a 4 Nations meeting with the 4 health ministers across the UK in regards to what the app will be, how the code will work. Ideally, I would like to see one app used across these islands, because it makes no matter where an individual is travelling, once we come out of lockdown, whether east, west or north, south, that same platform, that same app can be utilised. And that's the challenging piece of work that has to be done over the next couple of weeks. There's conversations that we are having across these islands to maybe see if they may not be the same app, but to make sure that they are compatible. In regards to Mike's actions at the weekend, Mike has resigned as Vice Chair of the Executive Office, and I think that was the right thing for him to do, because in my opinion there's no person, no position or no point of privilege that is above the guidance and the rules and regulations as to how we combat COVID-19 in Northern Ireland. And I know Mike, as a man of integrity, when he did, for the reasons that he did flout the lockdown rules, I know he had weighed heavy on his mind and he took the actions that he did.
Good afternoon, from Clemens Irish Times. I just wanted to ask in terms, Minister Swann, of you've been very clear this afternoon in terms of saying, now is not, we're getting ahead of ourselves in terms of talking about restrictions being lifted. And obviously there's been a lot of discussion and dialogue around North-South collaboration and what that might look like, and whether the North has lagged behind. In some respects, given what you've said and the fact that a plan and a sort of a detailed timetable plan has been published in the Republic of Ireland, might it be reasonable to assume that actually what may happen in terms of coming out of lockdown will be that Northern Ireland will take longer to lift the restrictions than in the Republic, and that actually Northern Ireland might potentially be doing the safer thing in regards to dealing with the potential threat of coronavirus re-emerging. And I want to ask the Chief Medical Officer as well, just specifically in regard to contact tracing, if he could give some more detail as to how specifically that contact tracing might work on that cross-border basis. I know, Minister Swann, you said that potentially it could be one single all-Ireland app. Do we know what that might look like, or are there more details you can give in regard to that?
Okay. Freya, I think, and in regards to timetabling and the steps that we take, I think it's right that we have the conversation as to what it will look like coming out of lockdown, but I think putting a timetable on it at this minute in time, where we don't know where the virus is or how it's going to react over the next week or 10 days, I think wouldn't be the right thing to do. In regards to us not being in the same timetable or in the same step as the Republic of Ireland, I think as an executive and as the Health Minister for Northern Ireland, we'll make the decisions that are right for Northern Ireland at the right point in time, depending where the virus is in Northern Ireland.
Thank you, Minister. Thank you, Freya, for your question. I think in terms of the timing in relation to the measures that are in place, I think we need to all recognise that there are quite extraordinary measures that we have put in place across these islands, and to thank the public for adhering to those in the manner in which they have, and the fact that, as I said before, and I think it's worth repeating, it has saved lives and it allowed the health services across these islands to respond to the pressures, and the pressures that could have been, thankfully in this wave, at least have not been realised. It may be a different matter into the autumn or into the winter when there is the potential for further waves, and we just need to bear that in mind. We have, as indeed all jurisdictions, have a statutory and legal responsibility to review those measures on a 3-weekly basis. That's right and proper because they are so extraordinary, and the impact that it is having, as I've said before, whilst those measures are saving lives, they are also causing harm in terms of health, in terms of the economy, and in terms of wider society. So at each step, we need to look at whether those measures are still necessary, whether they're proportionate to the level of risk posed by the virus and its circulation, and whether or not it is safe for us to step back from or lessen some of those measures. That isn't the time at the moment. I think it is important that people do see, as someone once said earlier, that there's light at the end of the tunnel. That, as I've said, that this has a beginning, and we're still in the beginning into the middle, but that there will be an end to this wave. But the other thing we need to bear in mind is that we need to be careful about our public messaging here. As Minister said, we're heading into a bank holiday weekend. People have persevered, but people are tired, and we have a number of weeks to go yet before we're in a position where I believe the evidence would suggest it would be safe for us to step back or step down any of these measures without seeing that our number increase and us then getting back to the situation we had with exponential growth. Now, in that, we need to have a mature conversation with the public, treat them with the respect that they have demonstrated and the maturity that they have demonstrated over the last number of months, and we will do that. I know that the executive will do that. There is, as Minister said, an executive meeting on Thursday, but we just need to ensure that we don't give mixed messages at this time, and I would be very reluctant indeed to put in place a artificial timetable or time frame for those decisions prematurely. What we will need to do is carefully map our way through a step-by-step, any changes in the measures we have in place and any consequence in terms of how people are behaving or any consequence in terms of the impact of the virus in terms of community transmission. And to do that, we need to have that surveillance in place, and we absolutely need to have the test, track and trace approach in place. Those are prerequisites, absolute prerequisites for us stepping down or away from any of the current measures.